Hello and welcome to the Headache Doctor podcast, where it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication, allowing you to thrive in everything you do. On today's podcast, we're going to talk about tension headaches. Tension headaches are some of the most common types of headaches, and we are going to provide you with the information you need to understand tension type headaches and then to know what to do about it, to self-treat. And then if you need something more than self-treatment, what should that look like? So tension headaches, what are they and how to avoid them? So just under 40% of the population will experience tension type headaches, okay? 40%. So not a majority, but tension type headaches are very, very common. Slightly more common in women between the ages of 30 and 39. And what's interesting about tension type headaches is that the prevalence actually goes up with the higher levels of education that you have, okay? And I'm going to guess that what that is referring to and why we find that information is because if you have a graduate level degree, that's where people that have the graduate level degrees tend to have tension type headaches. And I think that's because you're sitting at a desk. You're likely sitting at a desk. So you're doing more of sedentary work. Your lifestyle, maybe there's stress piled on that, but I feel like everyone has stress. When it comes to the higher education levels of people that have tension type headaches, I think it's because you're sitting. And I think that's a common theme. And we're going to talk about that with tension type headaches. We talk about that a lot on this podcast. We talk about the sedentary lifestyle, sitting posture, and how that leads to the type of tension and restrictions in the neck. Now, one of the things that we're going to sort of flesh out here is how tension type headaches are different than maybe a cervicogenic headache or a migraine. And so let's first start off with, how do we diagnose tension headaches? Tension type headaches are very common, and you've probably experienced one. If you have headaches or migraines, you've probably experienced a tension type headache, or you have a tension type headache combined with your migraine experience, or maybe you have a tension type headache with a cluster headache. Tension type headaches are very common for the types of patients that we see, but I would say for some it is their primary headache, but for others it's sort of a secondary headache that's there. And people will say this all the time, that they have migraines, and those might be once a week, every other week, once a month, something like that. But they also have this like low-grade tension headache that will just be there, whether it's chronic and it's there almost every day, or it's episodic and it will come and go. In both scenarios, we want to understand where that tension type headache is coming from. But first, let's talk about how we diagnose it. Diagnosing headaches is very much, it's connected to the symptoms that you have. So the presentation of pain, the location of pain, the duration of pain, how you describe the pain. And so what I mean by that is the pain throbbing? Is it sharp? Is it stabbing? Is it burning? Location of pain is important with tension type headaches because typically tension type headaches present in the forehead. They can be described as a strap-like headache in the front of the head, or that goes around the head. Oftentimes they're accompanied with like a pressure sensation in the head itself. And generally it's the front, okay? There could be a level of like stress or tension that's typically secondary. Sometimes people have to think about it in order to really evaluate if they have tension in their shoulders or their neck. But usually once they do, they go, oh yeah, I do have a lot of tension. I carry my tension in my shoulders and my neck. And typically that will accompany that pain presentation of the strap on the forehead type of a headache, which would qualify as a tension type headache. In addition to just the intuitively tight shoulders and neck, which is what the tension in tension type headache is referring to. Tension then causing the headache experience. Tension can mean a couple things. It can mean the physical tension that you have in the musculature of your shoulders and your neck. I think oftentimes people use tension to mean like stress as well. And so the emotional stress, the stress of work, stress of life, relationships, whatever it may be, the stress of travel around the holidays, maybe you are experiencing that. Whatever stress might be, people oftentimes say that they have a tension type headache or a tension headache associated with both the emotional stress and then the physical stress on their body that leads to muscle tension. So a very simple explanation of how we diagnose tension headaches is you walk in to a clinic or into our office and you say, I have a strap-like pain in the front of my head, or my pain is on both sides in the front of my head. And it might start in the neck or in the shoulders, but primarily it's just going to be located in the front and on both sides, which is different than oftentimes what could be. So oftentimes migraines will present as a one-sided presentation. Tension type headaches are typically on both sides. It's not common for a tension type headache to present on one side. Now, does that mean if you have a migraine, you don't have tension? No, definitely not. It means that the pain signal your brain is receiving is maybe coming from a more specific location. What I mean by that is if you have a very specific pattern of pain from the back of your head that wraps up and around and maybe sets behind your eye and feels like a stabbing sensation in your eye, what we find there is that usually there's a very specific spot. And typically it's connected to a joint. So there's a joint that's restricted. There's some muscles around that joint that are very angry. And that specific location on your neck is the source of pain. And that pain will travel up and around and be very aggravating. So the brain's getting a very specific signal. Tension type headaches are typically more diffuse. Okay, so the brain's getting a pain signal or an irritation signal from the neck, from the shoulders, from all of these different muscles that are trying to hold your head up and your shoulders back. And that's why it's more of a diffuse. It's just the front of your head hurts, your whole head hurts, you have like pressure sensations. And so that's one of the differences between a migraine and a tension type headache. Cervicogenic headaches are also typically one-sided, so that same sort of hurts in the neck, wraps up and around. It's another conversation, which I've talked about before, the difference in diagnoses and how you're really just describing your symptoms, and then the medical field will slap a diagnosis on that and then send you out with a prescription, which what we're trying to do on this podcast is change that. We want to understand why these things are happening and how to correct them. So you have tension. I want to talk through a few things that we see clinically, and then we're going to talk about where it comes from and what to do about it. But clinically, if you come in and you have more of a tension type presentation, so more of a diffuse, not very descriptive, it's just like the front of your head hurts or your whole head hurts. And the other key thing about tension type headaches is they typically onset in the afternoon. All right, so we're connecting these to the sedentary positions that you're in. We're connecting these to the postures that you're in, maybe computer work, desk work, anything that is causing you to sit and your shoulders are forward and your head is forward, okay? So they onset in the afternoon, not as descriptive, front of the head, both sides. Now, clinically, when I'm working on someone, when we are working on a patient that has tension type headaches, everything will feel tight. And I guess I shouldn't say everything, but there's a lot of the musculature in the shoulders and the neck that will feel that it can't relax. So someone will lay down on the table, they'll be horizontal. There's no reason for their shoulders or their neck to be having to do any work. But those muscles will be activated, and it'll be just like a tight band throughout the muscle itself. And typically there's specific muscles that are doing a lot of work, let's say the upper trap or levator scapula, but then there's other muscles that are like, I guess I could use the word atrophied, like they haven't really done much in a while, okay? So there's almost an element of deconditioning that happens when someone presents this way. And so they lay down and there's just like general tension. Now, I'm going to contrast that with someone who has more of a specific, we'll call them trigger points or knots. So the band of muscle will be relaxed, but there will be one specific spot in that muscle that will have these fibers that are contracted, which is a knot. It's the trigger point. And that specific spot will be angry and sensitive, and sometimes that will actually send pain somewhere else, a referral pattern. And that's oftentimes what will actually be able to reproduce someone's headache or a migraine. is that trigger point. When someone has tension type headaches, we're not always looking to like reproduce their headache because they have all of these different structures, whether it's the shoulders, the upper trap, the levator scapula, these paraspinal muscles in their neck, the suboccipital muscles, all these different muscles that are just kind of angry. They've been asked to do a lot of work throughout the day, and by the time 2 o'clock, 3 o'clock rolls around, they're just sort of angry and you start to have a headache. Okay, so again, it's less of like a specific spot and more of a just the whole area is angry. All right, so clinically, the hands-on approach and what we do is very, very effective. So that can change a little bit just because maybe we're not spending as much time on one specific area. We're just trying to address everything as a whole. But there's also tension type headaches for someone who's looking for self-care, or how do I impact my situation? How do I take control of my own health? This podcast will be very helpful for you if you have tension type headaches, because tension type headaches oftentimes can be controlled relatively well with just some lifestyle changes. So understanding where it comes from is important, meaning where's the pain coming from and why would the pain be there? Okay, so let's start with like the actual triggers of pain. So we've talked about I've referred to the neck and the shoulders. All right, so when we think of the cervicogenic headache and the migraine headache, it could be more of the joint, specifically the joint. Like there is a joint restriction that is leading to these headaches. With tension type headaches, oftentimes the joints are restricted, but the actual pain itself is coming from this just general tension. So when I say the suboccipital area, that's the area just below the base of your skull, the top part of your neck. Now this is typically a sensitive area for people that have headaches and migraines. So when I'm describing that, they're usually like, oh yeah, I know exactly what you're talking about, because you push there and it's kind of sensitive. That area can be sensitive for people that have tension type headaches. But often now, because there's little tiny muscles that help control sort of like fine movements of the head, where that's nodding, slight rotation, side bend. And those muscles are really small. They only cross a few segments of the upper part of the neck. So you go from the base of the skull to the first bone, the base of the head to the second bone, and they only control those little movements. Now those muscles themselves can be sensitized and angry, but in tension type headaches. But typically in tension type headaches, you have tension through these bigger paraspinal muscles. So these are the muscles that run along either side of the spine, and there's different muscle groups. And if you're going back to physical therapy school and looking at my anatomy book, they have them all like clearly color-coded and fleshed out. But in reality, it's just sort of this big sheet of muscle that runs from the back of the head, connected through some ligament tissue, all the way down to the low back. Okay, so you've got kind of from sacrum to this suboccipital area of muscle. All right, and these muscles, when they contract, they're generally allowing us to extend. So extending the neck. Now think of your posture and positioning when you're sitting and your head is forward, okay? Your eyes are likely still on a horizontal plane because your screen's probably in front of you or maybe a little bit down. But even if it's down, if you're sitting with this forward shoulder posture, forward head position, the mid portion of your neck is going to have to extend. And naturally what that does is that brings in these paraspinal muscles. So these muscles that are on each side of the spine, they contract in order to hold your head up. Now remember, your neck is being tasked with holding up a 10 to 12 pound head, about the weight of a bowling ball. That's a lot of weight. If you were tasked to hold a bowling ball for 8 hours in a day, you would probably hold it as close to your body as you could, because that's going to have the least impact on your joints and your muscles so that you can actually sustain holding a 12-pound ball for 8 hours. Now, when you sit or stand, it seems pretty benign to just sit with some funky posture, have your head forward or shoulders forward. But in reality, you're asking your neck and your shoulders to do a lot more work. And so generally what happens is these bigger muscles have to kick in, these paraspinal muscles. And those paraspinals don't really want to do all that work throughout the day. because we're really designed, when we sit with a neutral or stand with a neutral posture, a lot of that weight of our head is actually resting on the spinal column itself. But we're asking those muscles to do extra work when our head is forward. And this is getting into why at 2, 3 o'clock in the afternoon you start to get these headaches. So these paraspinal muscles are asked to do more work. In addition to that, you have the shoulders that are anchoring or sort of tethered to the neck, all right? And actually the upper trap, levator scapula, they insert up high. The upper trap actually has, and the levator scapula can have insertions all the way up into C1, so the uppermost vertebrae in our neck. And so as our head is forward, not only are those paraspinals having to kick in to try to hold our head up so our head just doesn't flop forward, but the shoulders as well. So the upper traps and the levator scapula are shoulder muscles. They attach into our shoulder blade, and then they insert, so they originate in the shoulder blade, and then they insert into the upper part of the neck. And those also kick in, all right? And again, it's this general tension. It's tension over time. So one of the problems is not that we're asking our muscles to do that, because they're very capable of doing that. They really don't have a problem doing that. But when we multiply that by time, that's where the problem comes from. So maybe a day, that's fine. Maybe a day multiplied by months, maybe a day multiplied by years is okay. But at some point, your body is going to get tired of, one, not providing it with the movement that it's wanting, and then two, asking it to hold this bowling ball up for 8 hours a day, every day of the week. And then what happens is one day you're at work and it's 2 o'clock in the afternoon and you think, wow, I have this headache, and you pop some ibuprofen, and then it might help, but that tension is still there, and that tension is the problem. That tension has been there for so long because you've trained your body to do that, but it's not liking it because that's not how it was designed. So what do we need to do? And this is what we're going to talk about now, what to do about it. And this is where tension type headaches can really kind of be in your grasp or in your control to some extent. So I say this a lot in the podcast, but I want you to move more. Get up and walk around. It will help you immensely. And people oftentimes overlook the negative impact of prolonged sitting. Like I said, you sit, you stand, you're looking at a screen, you're looking at your phone, you're sitting weird on the couch. When I say weird, it's common. Everyone sits in like these kind of funky positions, but weird in the sense like we're asking our body to kind of do something it's not really used to. And in short spurts, it's fine. It's totally fine. But when we teach our body to do that over and over again, that's the problem. And so the moment that you're doing that, you may not feel tension or irritation in your neck or shoulders. But actually, what I want you to do is start to evaluate yourself. As you're sitting, I want you to think, how does my upper back feel? And I'm actually doing that right now because I'm sitting recording this podcast and I'm thinking, man, I need to move. I'm telling people to move. I need to get up and move around. Don't worry, this is less than 25 minutes, so I'll get there. You need to move more. And even this 25 minute podcast that I am speaking to you, I don't have headaches. I mean, I'll get headaches infrequently, but I am not someone who would ever think, outside of what I do, I would never think like I have a neck problem or I need headache treatment. I would never think that, okay? So my body has it has tension, but it's not enough to send off the alarm bells to start sending pain into my head, okay? And after 20 minutes, I'm starting to feel that my upper back and my neck need a break. They need to move, all right? So what I'm telling you is think about your day. How often do you put yourself in situations where you're sitting for 20 minutes or more? And for those patients that we have in clinic that I talk to, most of their day is sitting, like much longer than 20 minutes. Just understand that is going to add to the stress of your neck and your shoulders. So get up and walk. I want you to also, when you're standing, if you have a standing desk, stand with an active posture. Don't just rest on your ligaments of your knees, of your hips. I want you to actually unlock your knees, engage your core, and stand in sort of an active position, almost like, I call it an athletic posture, but almost as if like you had to move quickly.